Hello and welcome to Newslaundry's special series and navigating the second wave. And here we bring health experts to talk to them about different aspects of this pandemic and ask a few questions which are on our minds. Today, we'll be talking about how to prepare for the third wave, misinformation around the virus, and the dangers of lack of data. And today we have with us Dr. K. Viswanath. He's a professor of health communication in the Department of Social and Behavioral Sciences at Harvard T.H. Chan School of Public Health and in the McGraw-Patterson Center for Population Sciences at Dana-Farber Cancer Institute. Dr. Viswanath is also the director of HSPH, that is, I think, Harvard School of Public Health India Research Center, which is in Mumbai. And he also serves as chair of the Working Group on Vaccine Confidence, National Vaccine Advisory Committee for the US government. Hello, Dr. Viswanath. Thank you for giving us your time.
Good evening. Thanks for having me.
So what we do is I'll ask you a few questions and our subscribers who have joined us would send in the questions they'd like to ask you. And after I ask a few questions, I'll ask you some of the questions our subscribers want, right? Where should we begin? I was thinking about what we should begin with. And in India, people have started to talk about the possible third wave. But average infections per day are still higher than what they were. For instance, July 15th last year was less than what we had yesterday. And if we go by the weekly average from today's numbers also. So essentially, my first question is, are we right to assume that the second wave is over?
Yeah, I find it rather puzzling when I heard the discourse about the third wave, while India is still in the throes of the so-called second wave. Usually, I'm also reluctant to talk about waves and crests and troughs as if, somehow they imply that it has disappeared, it has abated completely and it's coming back. Given the nature of testing, limited testing, I somehow don't feel completely comfortable with a metaphor or analogy. So having said that, I think it is critical, essential to focus on what the current crisis and plan on how to come out of this crisis, and then also at the same time take steps from preventing another surge down the road, I think. So my own feeling is it's still a serious problem in India, as it is in many parts of the world, and not really get obsessed about a third wave or a fourth wave and so on. So.
Yes, because the thing is, what I felt, and correct me if I'm wrong, please. When people talk about infections or surge in infections in terms of waves, the normal cautious behavior tends to go down. So the question is, people are already showing tendencies for letting go or, ignoring the COVID appropriate behavior, be it masking or maintaining safe distance.
Right.
And you work in public health messaging. So how does the messaging keep up with the extraordinary fatigue, right? In people's minds, if nothing else?
It's a really great question, and it's something that we have been thinking and talking a lot about, particularly now at this point. We are 15-16 months into the crisis, and there is this general fatigue in thinking about COVID-19, masks and vaccines. In fact, if people tell me, I don't want to hear more about it. I just heard from somebody who is actually an ID doc, said, okay, I'm going to mute vaccines and COVID-19 from my social media account. So you can understand why there is a fatigue, I think. So, it's very critical to freshen the message. And here is what I say. We, instead of just getting obsessed with this discourse about future surges and the third wave, and I can assure you, when there is so-called third wave, there will be a discussion about a fourth wave too. And also, the best thing is to say, what is it you need at this point, to keep yourself safe, to keep your family safe and keep your community safe. And that's one, I think, The second thing is, one of the challenges we have faced in public health, and certainly in the government, when authorities are communicating, this notion of don't, right? This kind of a scold approach, and people are tired of it. So I think we need to really think through what are the advantages in adhering to these kind of a guidelines, and promote that adherence to the extent possible. That will potentially help, especially with 16 months into the crisis. You see that not only in India. I think I know that you are all concerned about India, and people have a tendency to blame, we in the India are not caring or bothering enough. But it's a problem I'm seeing everywhere, so including in the US, that fatigue, and it's a real challenge, I think, now especially. So
yes. So I wanted to ask you a question about some other type of fatigue, but because we've talked about this wave and the surge in infections, and this, I frequently call it, in fact, seemingly inevitable surge in infections. Is there a way to get away from this quote unquote third wave? Is there a way to prevent this? Because I see people who know about this, who are intelligent about health and medical science, biology, how viruses work, even they are starting to let go of all these things. And we see, but at least some of us are foresee that this surge is coming. And is there a way to prevent ourselves?
Right. So let's step back, right? Let me first make it clear. I'm not a biologist and an epidemiologist. I'm a social scientist. So I understand human beings better, and institutions and how they work, right? But let's step back a little bit, right? This pathogen, if nothing else, has taught us that it is making us humble, because we can never predict its course, right? If we go back and think about what we thought we knew in January of 2020, and now we are in July of 2021, we have learned a lot, but we still don't know a lot. Now, if we acknowledge with certain amount of humility that this is an unpredictable pathogen that has its own way of mutating, and mutation is normal, there are some parts of it which we can't control, right? So we didn't think about Delta variant, which is much more transmissible, much more virulent. But so that part we can't control. So the question is, from a prevention perspective, I can't say we will avoid a surge, but what we can do is we can minimize the impact of a potential surge, right? And that's where the prevention aspect comes in. It is in our hands to do that. When I say our hands, collectively, both institutions as well as people, by taking certain precautions, certain steps. That by itself is not rocket science. Individuals and publics, groups can take a number of precautionary steps, and we can go into the details, okay? Government can play a significant role in actually promoting that public health mitigation. And again, we can go into the details. Number 3, hospitals and healthcare institutions can also get ready for potentially people, coming into the hospitals, their ICUs, etc. Right? So we have learned a lot. If we take these 3 actions or sub-actions, we can actually minimize the impact should there be again another surge. So because this is not going anywhere anytime soon.
Yes. So this brings up the question of inequities, because not all of us are equipped, as you said, to deal with it in the same manner. Even our biologies, our anatomy is not equipped to deal with it in the same manner. And in this time, for journalists or for public health professionals like yourself, inequities have risen so much and increased so much. How does public health deal with it? The individuals can deal with it in their own manner, but how does, as a collective, as a system, we deal with it?
Right. So if there is one thing that keeps me up in the night, in addition to the fact that there are tens of millions of infections and deaths, if one thing that keeps me up in the night, it's the issue of equity. What we have learned globally is that while the pathogen has spread, the infection has spread amazingly fast in all over the world, the impact has been disproportionate across. In India, it's caste, race, class.
Yes.
In the US, it's race and ethnicity. And you can also go up one level, countries, right? Certain countries were much more affected than other countries. And now we are seeing the vaccine inequity. I mean, it's a crying shame. It's actually a crime in some ways that we are also seeing the vaccine inequities, I think. You're absolutely correct. That's why we have to distinguish between private medical care versus public health, I think, and public health is exactly that. I think if we can laser focus on the underserved and who are more likely to be and how, we are able to take some steps. Let me give you a couple of examples, and I'll be happy to again elaborate, right? So one, you take vaccination, right? India is doing pretty well in terms of vaccination. I think, it's just that you have a large population. So
in numbers.
In numbers, so the proportion is lower compared to other countries,
yes.
But the sheer numbers, raw numbers are very high. Now, the question is, can you ensure that vaccination is equally accessible to everybody, irrespective of their place or class background, right? So, it's easy for me to get into a car and go to a vaccination center and get vaccine. But if I am not, if I'm relying on public transit or something else, it's very difficult, right? If I had to take a day off from work and go to get vaccination centers, if I am in a village and if there is no a place for me to easily get vaccination, so there are steps. India has a great record on vaccination, right? I mean, India has a great record on vaccination. So the question is, can you activate that? That's one example. The second way to address the inequity issue is, for people like you and I, who are employed in this kind of a white collar knowledge production kind of an economy, we can work from home. We can pretty much work from anywhere, and I can prevent myself from being exposed in any way. Yes. On the other hand, if I am a rickshaw puller, or if I am, a domestic help, or if I am working in a shop stocking or with customers, then I have very few, or any kind of a blue collar employment. That's very, very difficult for me to stay back and protect myself from exposure. So the question is, how do we protect them, and how do we make sure that the customers who come in are actually complying with the rules? I have seen where customers have fought with frontline workers, right, in not wearing a mask when they were asked to wear a mask, or I'm sure it has happened elsewhere too. You take our say people in railways or in buses, our conductors, or in airlines, our flight attendants, people are not wearing masks. So they're exposing these workers, our frontline health workers. Strictly enforcing compliance with public health guidelines, again, can protect the frontline workers,
Yes.
The other point, again, another example, and then I will stop after this, is making sure that they have access to personal protection equipment. Again, we can invest in it and make sure that they have it. These are, just three examples of how we can minimize these inequities. So, I mean, in a country, and globally the same thing, right? The vaccines is an issue. I'm pretty upset in the way the advanced industrialized countries have so far been so selfish, including the US and other countries, in hoarding vaccines. And no one is safe until everybody is safe, and that's the lesson we are forgetting. Anyway.
Yeah, but the thing is, not this point doesn't seem to, set with everybody. people are. So this brings up my next question, which you said. So we were talking about inequities, but within a public health system, for instance, India, different states or city or small districts or smaller towns would have different health infrastructures. So how do you ensure parity of, let's assume, vaccination or testing or new kinds of testing, which people are talking about, we should introduce so that we can chase the infection rate? How does one institution or one set of people, let's say India, deal with it? Because these inequities have been set in for decades, and now we are at some sort of a precipice, but when we need those services.
Yeah, excellent point. So let me so it's very easy to get sort of depressed. Depressed is a very too strong a word, but easy to get sort of disheartened. You look at the decades of inequities baked into the system, right? But let me make a couple of points. Number one, that system is not natural, right? It is designed, it's social construction, yes. Right? It's somebody sitting down somewhere making a policy and the implementation of a policy, right? I mean, when I say policy, not just a government policy, it's also the companies, say hospital chain deciding that we'll set up somewhere in town X versus town Y, right? So these policies are mutable. These decisions are mutable. And the question is if there is a political willingness to do that or not? I think that's the one issue, right? So I can make a decision saying, okay, from a corporate sector perspective, from a government perspective, I will deliberately start building institutions in certain towns where there is a much more limited access compared to other towns or cities where there's greater access, right? And you're not saying I'll build a total hospital. I'm saying an infrastructure to address this issue, right? A mobile clinic is a good example of that, right?
Yes.
It's not costly. The second thing is, as I keep saying, India has a track record. I think one can get easily, one of the things I have been very frustrated about the news coverage in the US and other places is this incessant pictures of funeral pyres, and then that gives you an impression that's nothing happening, right? But if you think about it, India has a very good track record on vaccination. Polio is a good example, right? Smallpox is a good example, and what I'm saying is there a way to activate that, right? So you don't have to build something from the bottom. You can actually activate from your prior experience, and make sure that you use that and tap into that to promote equity issues, I think, and reach people. This is not rocket science. We have done this before, and we can do it, but you got to have the willingness to do it.
Right. Of course, political willingness would depend upon the competing interests. But you talked about the reportage in US media. But that brings us to another question I wrote, but I'll ask it now. The reportage of COVID, because this is also your subject. And there was a big debate in India right now, though in the context of third wave, it's not relevant right now, but it might. About the vivid images, like you said, of funeral pyres or dead bodies or patients dying helplessly on roads, let's assume. And many people came to criticize that. But as a journalist or as someone who works in news business, I would wager those images were important because we've seen the lack of data or misreporting of the data would have gone unnoticed had those images or that reportage didn't happen. So how does one juxtapose these two things, these two interests, which seemingly both are in public interest? But
right. So let's think about that a bit, right? So the nature of reporting is such that you have stories, narratives, and pictures. especially if you're a television medium or a visual medium, got to have pictures, right? So that by itself is not a bad thing, I think, you know. But what I'm suggesting is that while you cover the gravity of the situation, and you don't want to sugarcoat the gravity, right? I mean, if somebody is dying outside the hospital because he or she can't get a bed and the family can't pay for it, or if you have a story where people are running around helter-skelter trying to secure oxygen, you don't want to sugarcoat that, right? Obviously, right? But you also, what it is, it's a question of balance. When I say balance, it's not about negative coverage, right? Because I also want to make this point about journalism has been a saving grace in COVID-19, and I'll talk about it, why that is the case. But you have to also give people hope in terms of practical advice, right? So there is, you know, Indian doctors have made, some of them have made excellent, outstanding points. If you get COVID-19, you know, not all of you have to end up in hospital, for example, right? There are things you can do to take care of yourself at home. COVID-19 infection is not inevitable, right? There are things that you can do at home and within your community, neighborhood, to prevent it. And to me, that was missing. What was missing was not enough attention globally, I think, you know, on this lack of public health preparedness and lack of public health mitigation measures. And so there is that lack of balance. So when you see only one side of it, then it doesn't encourage people. You know, it doesn't create that kind of a normative environment where it says, oh, most people are wearing masks, you know, I don't want to be that lone wolf not wearing it, you know. So that's important. I think we have studied this issue, how this coverage impacts people. And this is one of the things, you know, we learned from it.
I'm sorry to interrupt you, but wouldn't the inverse be true? Let's assume there is a person, there are two people who are wearing masks and rest of the people don't. So these two people are also feel pressurized to remove their mask or give up on them. And
absolutely,
that's where I think public health comes in. Absolutely,
you're absolutely correct. In fact, when we talk about normative, you know, the norms are, you know, I mean, what is socially acceptable, right? Yes. If it is not socially acceptable in my group to wear a mask, I won't wear a mask. I don't want to stand out because I'm a conformist, you know, yes. To the group norms. On the other hand, if everybody is wearing a mask, I will wear a mask. So you're absolutely correct. That's the reason I keep pushing this thing. And I'll keep repeating it until people get tired. You are not an island, you know. You do what people around you do, and that's why it is so important for us to have this kind of a, you know, for want of a better phrase, public pressure on positive public health behaviors. You know? Right. And I assume because the nature of the problem is it's evolving. The other infections we have seen, at least I have seen in my limited life, they were set, the research was set, the treatment or the vaccine was set, that this is what you're supposed to do. This is ever changing, it's evolving every day and every week. So that may be the problem. But on inequities, you talked about the messaging, and another question I wrote about inequities came to my mind, the agency to disseminate a message. So what we saw during this pandemic, that very famous, I would assume good intentioned also, people spread false messages which they had no clue about. And public health experts, health professionals, doctors tried to disseminate the messaging, especially in social media. They could not. And do you see it? I'm sure you see it in the other parts of the world too. How does one deal with it? How does good message get disseminated more than the bad one? Right. So I'm sort of laughing, you know, maybe instead of crying, because this is right. World Health Organization calls it the infodemic. and this idea. So there are three issues here, I think. One is misinformation, and other is disinformation, right? And the third is just a sheer flood of information. Earlier, we talked about fatigue, right?
Yes.
I analogize it in my talks as drinking from a fire hose.
Yes.
It's just flooding from everywhere, right? All around you towards you.
It's overwhelming.
I'm sorry?
It's overwhelming.
It is totally overwhelming. I don't know how would I cope, right, with this deluge of information. So I would so let's get to the misinformation part of it, right? So we always had misinformation. It was never it's not something new, right? In fact, advertising, if you remember, we used to call them snake oil salesmen. That's how it started, right? Selling a panacea for any illness, cures. But I think what has created the problem is the social media here, and that's why I said, journalism has been a saving grace, because in journalism, we have the reporters and then we have the editors. We have the organizational practices which ensure that most of the news stories go through some gatekeeping, right, of some kind. So by the time it comes into the press, there is at least a semblance of checks, series of checks. But on social media, anybody is a producer, everybody is a producer, and everybody is a disseminator, and I think so. There are two solutions to this. One solution is individuals taking responsibility and not forwarding everything they receive, right? This is what we said as being finger happy, like trigger happy.
Yes.
Particularly with WhatsApp, and I mean, Facebook and others too, Facebook and others, it has become so easy to just tip, and then it goes right away to others. And there is this kind of a anxiety urge to share it with the world, I think, and I think encouraging people constantly to think through, we actually studied this issue of mavenism, where, there is a group of people amongst all of us who think they should share health information with everybody in their group. That's a good thing. The bad thing is they don't know any better than other people. When we measure the knowledge they have, their knowledge levels are not any higher than other people. So the question is to identify these influentials, these nodes, these mavens, and making sure that they don't, spread it. But it is not very effective strategy. And the reason I'm saying it's not very effective is you can tell people don't do it, they continue to do it. In fact, my dashboard has our dashboard has these examples, tips. That's where social media platforms have to take responsibility, and they are now beginning to pay attention because they have the computational power. They can, with the help of their algorithms and ability to monitor and act on it, social media platforms have to really aggressively minimize this. We can't eliminate misinformation. It's too late. The train has left the station, but we can minimize it.
Yes.
The social media platforms have been very reluctant, but now they are very anxious. A number of these organizations are actually making attempts. Some of these platforms are working with US institutions, for example, National Academy of Sciences, or with World Health Organization, to say, okay, how can we work together, to minimize this? And that's probably the more potent way than putting the onus on individuals to behave very well, So.
Yep. So I have a lot of questions and I can go on, but subscribers are also sending questions. So I would ask you one question, which is a bit personal to me. So we were talking about fatigue, and there is a different kind of fatigue in doctors and health workers and their families. And at least in India, I don't know that well about other countries. But the countries which are not doing well, where vaccinations are not that up and the infection is still raging on. And the doctors seem to be losing hope. And there's sort of a lethargy or nihilism. And have you encountered this in other places? And how does one deal with that? Because they are right now the most essential workers, in fact, in many ways, in all societies. Have you
Right.
seen that, and how does one deal with it?
Right. So there is a huge discussion globally, actually, about this issue. It's called as a burnout.
Yes.
And the burnout is not just doctors obviously, but nurses,
Yes.
are frontline health workers, right? You know, people, if you look at a hospital system, right, all across the chain, they're very vulnerable. They are tired. They're working shifts day and night, you know, taking care of people while worried about their family members at home, right? And there are places where there is a stigma, you know, where people are suspecting these doctors of bringing infections from the hospitals to homes and neighborhoods.
Mm-hmm.
This is a huge issue, and you know, and it's very frustrating to someone like me and others, you know, you and others. You know, we celebrate doctors, you know, for 1 hour or for 10 minutes. We clap and say, oh, we will, you know, wave a banner and a flag honoring our frontline workers, and then forget about them, you know, without more substantive changes. So this is a huge issue, not just you know, in India. It's all over the world, you know. So what can we do? I think number one, it's really important to make sure that we provide the supportive equipment for them. As I said, you know, I have heard notorious stories about personal protection equipment, doctors buying equipment on their own. You know, my colleagues here have actually bought masks and face shields on their own in the early stages of the crisis. You know, there's no reason countries, including India, you know, India is not, you know, everybody's, you know, we can't afford it. Of course, it's a very wealthy country in certain ways, you know, manufacturing in certain ways. And I think, you know, there's no reason not to provide the PPE. It's absolutely essential, I think. One, you know, as I kept saying, to protect everybody, not just, you know, a small group of people. The second thing is, you know, we really need to think about optimizing the workload on them. You know, you know, it doesn't have to be in a way that it falls on a small group of doctors or nurses or orderlies, you know, nursing assistants, etc. You can optimize their workload. You can optimize exposure, you know, through modern ways of doing this. Third, I think people have to collaborate, and this is what I keep saying. You know, when I don't take care of myself and responsibly behave, I end up in the hospital, and I'm putting load on the system. You know, so I need to realize, you know, but I don't think it works very well. This kind of what I call as an altruism frame. You know, where you say, look, you know, you're also affecting the rest of the people. It just, that's where certain order has to be imposed. And then, you know, and I just can't fathom this. Even in the US, we are having trouble. We don't pay them enough. We don't pay them hazard pay. They deserve it. You know, I mean, look at the risks they are taking. Look at the number of hours they are putting in. We all talk about, oh, we don't have the resources, we don't have the money. Of course we have the money. It's a question of where do you want to spend it and invest in. You know, and yes. I think, you know, that's absolutely important to do that. You know, I think that if you know, in addition to the vaccine equity issue, if there is a crisis that will go on for a while, not today, you know, not this second, third, fourth, or fifth wave, but the next 2-3 years, the biggest crisis will be the issue of burnout among our frontline health workers.
Right. I've seen this personally because of some of my cousins and other people. They are going through a burnout, quote unquote, and a lot of sort of depression has set in. But
right.
We try to keep them up. We try to keep them hopeful, but
right.
it goes on.
Yeah. So, professionals are reluctant to acknowledge the crises that they themselves are facing, right? I'm a doctor, I'm a nurse, I'm trained, I'm supposed to take care of people. I can't complain that I'm not doing well, right? But the fact of the matter is everybody needs a counselor. I mean, you raise an important issue. That kind of a mentoring and counseling is very important, and providing that help, because they are not care seekers. Unfortunately, they are caregivers, but they're not care seekers. And we have to really push them to say, if you are in the ICU, you see patients coming in, you're taking care of them, they die. How can you not be affected by it? I mean, you're trained to save lives, you're trained to protect people. And so they have to acknowledge, and we have to help them acknowledge that they are actually, depression. Maybe that's, again, that's a clinical word, in our world, maybe not, but certainly that kind of a counseling, that kind of a mentoring is absolutely important to acknowledge that this is something they will face and they'll continue to face it. So, and how do we help them? How do we do that? Provide that counseling.
So before I'm reminded again, I would start to give you subscribers questions. If I get a chance, I'll ask you one more. So Zuhaib Jamil asks, India has become a land of religion first in everything, and keeping that rationality out of decision making when it comes to the pandemic and how it affects people's lives, which we are losing year after year. Do you think there is a way out of this situation in years to come? And he adds, or by when you foresee India coming out of this situation?
Right. So it's a very complex question. So let me see if I can answer satisfactorily. Otherwise, I'll be happy to clarify. So, it's very difficult for me sitting 8,000 miles away to comment on religion in India. Actually, in fact, I'm very reluctant to comment on India, as if it's one India and somewhere sitting, in Cambridge or Boston here at 8,000 miles away. But if you think about it, what role does religion play, right? There are a couple of ways to think about that, right? So does religion and religiosity, there's a difference, religion and religiosity influence people's behaviors, and will that lead to spread of infections, right? Mm-hmm. So if, for example, without naming a specific religion, I would say, if your religion prescribes certain behaviors, right, then it may be contributing to public health crisis. Religiosity is a problem with all religions, and we are finding it everywhere in the world, right? One example of religiosity is attending church, mosque, temple. When I attend a temple, when I attend a mosque, when I attend a church, those are minor super spreader events, right? So the question is, can my religious institution, irrespective of my religion, my religious institution, take precautions to protect everybody, whether it is physical distancing, whether it is providing that hygiene, masks, so that's very important, religiosity as one example, right? On the other hand, Shardul, what we have faced, and this is a good question, what we have actually is we have religious leaders, what we call as a faith-based leaders, have been extremely helpful in promoting vaccination, because in certain parts of the world, they are more trusted, right? Yes. And instead of criticizing, what we can do is to actually draw on their credibility. In certain sectors, they are much more credible, certain groups. So draw on their credibility and promote these pro-social public health behaviors. And we have done that with vaccines. I keep going back. With polio, for example, we have done that. Very good examples where faith-based leaders have actually been helpful in spreading the message, in providing that credibility. So religion can be both positive and negative in my view.
Yes, in all communities, most of the religious leaders supported
Right.
the polio vaccine because there was a
Right.
lot of opposition to it. I remember.
Right.
Right. The second one is from Soham Joshi. He asks, can future waves occur without hampering the economy? And he adds, what kind of public policy will be required to ensure that public health and economy is not compromised?
Right. So I'm not a economist, so I should be very careful in saying,
Yep.
So, but this is very important, right? And that's why when people have asked me in these interviews and in my talks, so should India go back to lockdowns? Who am I to say, I'm sitting very comfortably here, and I get my salary and I get my, I am taken care of. So I can easily say, yeah, India should go into complete lockdown. And there are tens and millions, hundreds of millions of people who will be affected by it. As you had the crisis early on when people had to, migrant workers had to leave. So
Yes.
I'm very reluctant to provide that advice. What I do think from a public health point of view, I'm very comfortable in saying, and this is a difficulty everybody is facing again all over the world, right? From a public health point of view, 16 months into the crisis, we do have a good idea of what we should be doing, right? And we have a good idea. We have tried a number of experiments, right, in public health. And some of these appear to be working. So, physical distancing has been working. It's difficult, but it has been working. One of the most effective vehicles has been vaccination. It is working. You clearly see the data. I'm looking at the data now. Wherever there is high vaccination, even with the Delta variant, other transmissible variants, the infection rates have been lower, hospitalization rates have been lower.
Yes.
So I think continuing to take those public health steps, and aggressively pushing vaccination while you're waiting for vaccination, taking those public health steps, which are not very expensive, right? I mean, face masks, hygiene, physical distancing, community mitigation, those can be taken by the government, by non-profit groups and companies, right? It's not just government's problem alone. It is really a problem of everybody. And that's one thing that's, it's really this unified message is what is missing globally, in the US, it has become very politicized, but there has to be, everybody has to be on the same page, so all leaders,
So this brings us to one question I wrote when I was thinking I would ask you. We were talking about inequities, and this also comes into messaging. There is also, correct me if I'm terming it incorrectly, communication inequity also. And especially in a time like war or this public emergency, the emergency messaging becomes much more important. But in a country like India, where there are so many languages and so many levels of understanding of issues, like not even health intelligence, the understanding of health issues, how does one deal with it? And like, are there models? Is there work going on how to fix these issues in communication inequities?
Right. Yeah, actually, we our lab focuses on communication inequities or communication inequalities,
Yes.
And obviously, when we use the term inequity, that means it's unacceptable, it's unjust, right?
Yes. Yes.
And that is absolutely correct. So let me, I think we ignored this completely in the first, few months of this crisis. We totally ignored it. Let me start with an example and see how to address it.
Mm-hmm.
We sent an entire generation of students home, right, with no education. We said we close the schools, we close the colleges. Just imagine, right, hundreds of millions of children all over the world, right, have been sent home. And then in some places we said, oh, but you can do it through Zoom, right, remote learning.
Yes.
Now think about it. Irrespective of the status of the country, remote learning is not easy. especially in India, if I'm in a 2-room apartment or even a 1-room house, with 4, 5, 6, 7 family members, how many computers do we have? How many telephones do we have? How much does a data cost? Connection cost? And so that so-called digital divide is a great example of promoting or exacerbating those inequities. So now, so if I'm wealthy enough, I can have my room, I can have my computer. There are families with 2, 3, 4 computers and 5, 6, 7 phones. There are families with 1 phone being shared in the entire family, right? So we have baked into the system that inequity. So when we send children home and say you can do remote learning, I don't know the consequences of this experiment we have done over the last year in sending children home. I don't know the consequences. I can't even imagine what it will be for the next few years. So there are ways to do that. I think really taking an extremely serious look at providing these services, telecommunication services, and subsidizing them. Mm-hmm. In the US, I often say, in the northern US, where I am, in the northern side, where it's very cold in the winters, we subsidize prices for heat, because families can't provide or afford heating bills for heating. Same thing, seriously think about subsidizing telecommunication services, right? It's like as much we subsidize food in India, right? Think about subsidizing for some groups telecommunication services, number one. Number two, we know messaging works if you think about how to construct those messages. We have very good evidence for that, right? We don't have to be very technical. We can use stories and narratives, we can use frames, we can use exemplars. We have very good examples of how, not only what to say, but how to say it. And that can bridge the divide. Third, use credible sources, right? It's not scientists like me. Nobody cares, for scientists like me. But there are community leaders I trust. There are faith-based leaders I trust. Work with those faith-based leaders, work with those community-based leaders. There are, one of the richest things about India is the NGOs. It's very impressive. The range of NGOs doing this work. Work with them. They are working in the trenches. They know the community. And that's what we are doing in the US, actually. We are working with what we call as CBOs, community-based organizations, to provide messaging. They are very credible sources. So if you do those things, you can actually reach and mitigate these inequities in communications. We have fairly good evidence on this.
Nice. So the next question is from Jami and Rao. Jami frequently writes for us also. Hello, Jami. He asks, between government, non-governmental organizations, civil society groups, and individuals, where do you see the balance of responsibilities to prepare to mitigate the impact of a potential quote unquote third wave?
Right. And I'm glad the way you the questionnaire has framed it, right? That there's an implicit acknowledgement. Maybe I'm reading too much into it. There's an implicit acknowledgement that everybody has a role to play. It's just not the government. I think it's very important, because I often hear the government, but it's just not the government. Everybody has a role to play.
Yep.
And
which you were saying a while ago.
Yeah, I said that, right. So they have a complementary role. In my view, NGOs and other civil society organizations don't have the scale or the resources that the government has, right? I mean, if you want to do something in terms of policy implementation, in terms of providing resources, in allocation of resources, right? That's only the government can do. Number one. Number two, in terms of imposing certain restrictions, I'm being very careful here, not using a penal frame, not the punishment frame, but in terms of imposing certain restrictions and ensuring that those rules are followed and complied with, again, government has a role to play. But government is not that great at implementation in the trenches, right? The so-called, people say last mile problem. It's just not the last mile. You have to go to the last household, and that's where the NGOs and the civil societies have a significant role to play. Because I work with NGOs in India and civil society organizations, they know their beneficiaries better than anyone else. From every time I talk to them, it's amazing how much you learn, from their dealings, their interactions. They are the people who provide the kind of intelligence I need. What I mean by that is they are the people who say, the real need is this, X or Y or Z. That's very difficult to know if you're sitting in a state capital or New Delhi, what the real needs at the ground level are. And that's where I think, providing that intelligence back to the governments and implementing, helping in implementation, you asked earlier, or somebody asked, right, the kind of rules to impose and what is the role here. And, this, you said, you asked the question, right, should we have a lockdown or economy? What is the role? Yes. One of the things I'm very worried is when I say physical distancing, I kept repeating this. If I am in a 7-room house, or a 1-room house with 7 people, what is the physical distancing? What does it really mean? It's easy again for me to say that. Yes. But if there is a civil society organization, they may have a better ideas, on how to do that, how to provide that shelter, and so I think that's where they can play a better role. So that's a balance, I think, between civil society organizations at the implementation trenches ground level and the government in terms of policy and compliance level. And also, you should not forget, and this is something I keep repeating, private sector's role in it. If I'm a company employing 5,000 workers, I'm employing 5,000 workers plus their families and their immediate neighbors. I have a profound influence on what happens, and I am obligated to make sure that the workers are also taken care of.
Yes, absolutely. The next question is from Gursevak Singh, and he asks a straightforward question: what about mental health, and how to maintain it without being on screen?
Right. So we always talk about these things, right? One crisis or other, and that's the reason people are getting fatigued, because everything is a crisis. We use the word crisis, right? But it is not an exaggeration to say there is a mental health crisis brewing. Yes. We already talked about the crisis among our frontline health workers. Yes. And what they are going through. And the stress people are going through. One example is, if you have a child, children grow up through socialization with other children. Yes. Right? This pandemic pathogen is all secondary to them. And I learn not through a computer screen, but through interacting with my teachers, my neighboring kids, my classmates. And I think there is a huge crisis brewing there, and the other thing is there's a sense of anxiety, this unexplained anxiety, anomie, as we say, because they hear about this pandemic, but they may or may not understand the biology of it. They know that their elders in the house, parents are worried about it, etc. So this is a big issue. So we are saying that there are certain things you can do. Number one, if you are a parent, spend time with children, provide honest answer to them, make up games with them, have conversations with them, engage them in some ways, right? Number two, reduce screen time. That's the first. Reduce screen time. Social media and other media, not always bad, but television, etc., because you can do other things. Number three, I think we need to think about, India has a great tradition of meditation, irrespective of your religion, right? Of sitting back and thinking about things, whether we are doing it through prayer, whether just doing it in a secular way. I think it's very important. We know, we have evidence that it works scientifically. Number 4, we need to provide counseling. We need to start really thinking actively, how do we provide counseling in different institutions, in different places? I think so. This is a huge crisis. This is not going to disappear. We are going to live with it for the next few years. So we better start acting on it now.
Yes, because mental issues are already a taboo in India, which is
right.
And one thing I read, and I think it's a widely accepted thing, I won't mention where I read it because it's a different subject, but social isolation is one of the worst things you can do to a growing child.
Right.
And this has exacerbated that problem.
Right. Isolation is not only for children, even for adults. In fact, even as I'm talking to you, we are working on a paper on issue of this isolation and loneliness, particularly when you can't meet family. That's why I'm so worried about when I say, okay, you have to have physical distancing. You have to have this kind of a circumscribed movement. One of them is isolation and loneliness. And it affects people. It is a serious issue. And that's why you really need to think through how to do this kind of a community mitigation. So
Jami has sent another question, but Jami, I'll take it after I take other people's questions because they've been also waiting. Shantanu asks, Shantanu Sinha Chaudhary, you have mentioned that news media offers some kind of gate checking and consequently there is less risk of incorrect or fake news. But what happens when a horde of newspaper editors themselves have sold their soul to protect a particular kind of narrative? Then messaging goes for a toss.
Look, it's very difficult to answer this question in abstract. Whether publishers and news editors have political biases or other kinds of biases. I'm not naive enough to think that there are no biases. It's very.
For instance, I apologize to interrupt you. Let's take an example. For instance, it was the anti-vaccine propaganda being propagated by some fringe Republican groups in US.
Right. But that's different. Political parties, I'm willing to call them on it, because when I have the data, we published a paper which showed that if your party identification is Republican, you're much less likely to get vaccination. We actually published this paper, so I'm not averse to mentioning it. What I'm saying is reportage in general, there are specifics we can go into that. The reportage in general, the reportorial practices ensure that there is some gatekeeping, some editing, some checks, which is in contrast to social media posting. That's what I'm saying, because if I'm a reporter and I file a story, it goes to the copy desk. The copy desk may come back and say, what about these facts? There is a back and forth, and then it goes through another couple of layers before it ends up. So there is some semblance of checks. On the WhatsApp, nobody stops me from putting it on. There's no check. That's what I meant.
Right. So next question is from Ashok. He asks, why vaccines are the only defense against this disease? Isn't it more practical to focus on cure-based alternatives? One other question he adds, are we doing enough work on this, or are the pharmas deciding the priorities that may be suiting them better?
Right. So let me say this. Developing cures or medication, different kinds of medicines, is important, and certainly, and a number of pharmaceutical companies are actually doing it. There is a tremendous, I sit in Boston, Cambridge area, where mRNA vaccine and Moderna is located, and life sciences is in a very advanced industry, employer. So there is a lot of work going on, and certainly medication, developing medicines is important. But as I keep saying, you cannot cure yourself out of this disease. Just curing alone is not enough. You have 1.4 billion people, just take India alone.
Yep.
You can't get all of them into the hospitals, So if the best thing is to prevent them from getting into the hospital, that's the first thing you want to do, Once you're in the hospital, yes, you want to administer medication and other things. Or if you're at home, you're already sick, you can administer the medication. But my point is vaccination and preventive measures are before you get sick, right? Stopping people from get sick.
Yep.
If you have to cure all 1.4 billion people, it's not going to work. That's why prevention is very critical. While pharmaceutical companies are developing their medications,
Right. One question from Animesh, and then we'll ask the question from Jamie. Animesh asks, I am from Germany, and I see that in Europe, there are predictable rules and regulations for unlock or lockdowns based on the incidence rates, hospital beds, and vaccination numbers. This somehow is not a thing in India. How important is it to have such a system?
Yeah, so let me answer it as a principle, I think, and it's a good question. Yes. Let me answer it as a principle, I think. What is very critical is you got to have an evidence base. It has to be a data-driven decision making, and so you can develop a set of criteria, and based on those criteria, you can say, I will make a decision to open up or close or partially close, etc. I think, and that's what I would say as a researcher, and as somebody who believes in translation of evidence for policy and practice. Now, there are two challenges with my answer, challenges to my answer. One is, I'm not a politician. I am not a decision maker. So the economy of the state, or my company or my city doesn't lie with me. So it's easy for me to say this. But if you are a decision maker, this is only one of the decisions you have to make. You asked economy, right? About economy. If you are a factory owner, your own company's viability. So it's a little difficult at that level, even though I encourage to the extent possible, it should be driven by decision making, because otherwise we'll continue to pay the price. And second, I think India is not one country in some ways, as many people have observed. I think as a democracy, I think it's not like imposing, the fiat from the top. It's not possible as it is in the US, which is a democracy. That's why I think, it is so difficult to say, get everybody on the page. So let me end it by saying this. That's why I am a strong believer in persuasion frame, not the penal frame,
Right.
Because persuasion is the best way to get everybody on the page.
This question from Jamie is a very interesting one, and that's why I saved it for later. He asks, on equity and inequalities, if vaccines are to be available equally to all, then do you think an over-reliance on digital app-based registration and that type of delivery system was flawed?
Yeah, so since I have not used the digital app, I don't know how it works, but what we know what happened in Massachusetts. It was a complete flop, right? We went for the digital app in Massachusetts also, complete flop, In fact, it's very interesting. A woman who was on maternity leave sat at home and created a much better app than the government of Massachusetts did, So these apps they're very difficult to work, especially in a surge like this, right? So my point is, don't rely only on the app. The app is a great idea because that's where we are going as a world, but you have to provide alternative ways of registering and getting vaccination. And we are not learning our lessons, as I said, it happened in Massachusetts. It's happening in India.
Of course.
It's happening in other parts of the world. We know technology will have challenges. Of course it will have challenges. And it takes time to improve. That's why you have the alpha, you have the beta versions, and then you have the launches. So I strongly believe app is fine, but you got to provide these other alternative avenues. It's very critical to do that while you're refining this thing, because not, as we discussed, not everybody has access to data plans, smartphones, or computers.
Right. Yes. In fact, less than half the population of India has smartphones.
Right. Right.
So we have been going for over an hour now. So
right.
Thank you for joining us, Dr. Viswanath. It was a pleasure talking to you.
Thank you so much for having me.
We as a small team at Newslaundry have been doing our best to bring you factual ground reports and podcasts and interviews to give you the best information possible at this point. It's more important than ever that you support us and that you help us fight the good fight.